Yeah, so first of all, we have to acknowledge lack of access of care. Some people, when they have a quote unquote rash or a little bit of scalp irritation, they're not going to immediately go to the physician. You know, often our community is looking to natural uh, resources to help with skin issues because if the understanding is that you just have a rash in the skin, you might try natural herbs and ointments first. Then, when it gets really bad and intractable, you might go to your primary care initially. And if it is presenting in a way that is not the normal morphology that you would initially recognize, then they may try, topical medications that work in most inflammatory conditions, such as topical steroids. But as we know, psoriasis is much harder to treat than other rashes like eczema or other forms of dermatitis. So at that point, then they would often refer to a dermatologist. And then even some of us can misdiagnose psoriasis and skin of color for other entities. So, but usually when you get to a dermatologist, this is when we get our diagnosis and we can talk about the severity and possible comorbidities that go along with it. And I didn't go over this yet, but sometimes people will just will have manifestations of just the hands and feet. And so often it can be difficult to diagnose because some people think it looks like foot fungus, for example, or tinea pedis and other entities that can affect the hands and feet. And so, it can be somewhat challenging to diagnose initially.